It's so vital that we all understand this because it's really communicating what it is, As journalists, we all research, we read a lot, we want to understand, we contextualize, and the right information makes all the difference. So first, this Live Lighter campaign really stems from Novo Nordisk's new innovation. This is a GLP-1, which is semaglutide, that is a once-a-week injection. So let's simplify it. What is this? Dr. Chian, what does this do?
So in a nutshell, GLP-1 is a hormone. It's produced by the body to help us metabolize the food that we eat, and also it helps us feel full longer. The problem with the natural GLP-1 is that it's so short-lived in the body, around 2 minutes. So what Novo Nordisk has done is we brought innovation. We modified the hormone a little bit to make it last for 1 week, 7 days. And that's ultimately how it helps people, because it helps people with obesity feel full longer and feel full and feel lighter.
So, Dr. Wei, is this innovation the solution to really living lighter?
I'm not doctor yet.
Okay, go ahead.
Working on it. Yes, so Live Lighter, I think Live Lighter really represents a vision Novo Nordisk has in this therapeutic area. When we talk about Live Lighter, it's really about, it's a movement, and it is also a mindset change. And it's a mindset change for individual patients, for healthcare professionals, but also for everyone in this whole healthcare ecosystem, and that can make a contribution or help the patient living with obesity. I think for many years in the Philippines, or for many patients in the Philippines, many probably feel that this is a personal struggle. And as we saw in the movie, in the start of the session here, many probably feel that it's their own fault because they have obesity. I think through Live Lighter campaigns or through Live Lighter movement, what we want to establish is really that obesity is a medical condition. It's impacted by many factors. It's impacted by biology, it's impacted by your own genetics, it's impacted by behaviors, of course, as well, and diet and so on, or lifestyle. So there are multiple factors. But there are also things we can do something about it. Now we have a lot of innovation, we have science, we understand disease much better now, and through, at least in Novo Nordisk, through the last 30 years of research, and then we felt that we can bring more and more innovation and to the patient. And with innovation in treatment, combined with lifestyle changes, behavior changes, and we felt that we can really make a difference in patient life. So essentially, started to finalize this, is that I think we want to shift that conversation from understanding to more dialogue, from more awareness to taking actions, from perhaps just a single day about weight loss, but to looking at about what is the holistic health that one can bring.
Yes, that's very true. Alam nyo, when we think about GLP-1 injections, we only think about, losing weight, looking better, but it's frankly more than that. When your cardiometabolic numbers improve, what happens is, one day you don't have to use your maintenance medications. You can start moving faster, right? Your sugar starts to regulate. Suddenly, you're healthier. So I want to ask Mr. Anand Shetty. He is the Vice President of Novo Nordisk in Southeast Asia. What makes this innovation, honestly, a leader in this field? Why semaglutide? Why this?
Yeah, thank you for asking this question, which is very important. Basically, it matters what type of medication you choose for managing this situation. If you look at that at the regional level, there is increased awareness on obesity, but there is also an important element of choosing the right medication, sustainability of those medication, and also continuation under the medical supervision. If you really look at that couple of years before, probably this is what one of the patient's story we heard in the morning. be thinking about if the problem is with me. So that led to Novo Nordisk for putting research for the last close to 30 years and bringing with innovation. So the problem doesn't end here. The medication alone cannot solve the problem. We require a lot of awareness, education, access, and many stakeholders coming together to offer a sustainable solution to this chronic disease or the chronic problem. So Novo Nordisk is committed to drive this innovation, and our pipeline is very, very strong, and we are there for offering a better care for healthier life for longer, not for only offering a short-term weight loss. And my call to all those people who are looking to lose weight, it should not be looked into just a short-term weight loss or for aesthetic look point of view. It should be looked into much bigger, much impact on whole life, be it functionally, physically, or emotional well-being.
And I want to ask you, because Novo Nordisk is the global leader when it comes to GLP-1s. First, you became very popular, literally the leader when it comes to diabetes care, right? Now, you moved this GLP-1, still semaglutide, to weight loss. I want to ask Anand first, what makes this one different from the first innovation when they are both semaglutide?
Yeah, I think today I can definitely speak about the molecule which we are now bringing the access in Philippines or we launched it across the world. This product comes with a lot of evidence claim. We can confidently tell that more than 37 million years of patient use across the globe, and a product comes with which is more suitable for the patients, which offers most of the weight loss is fat loss, which is very important, and also giving a very clear evidence to the patients of reducing food craving. So for us, it makes a very, very important and evident today when we come and bring this product, we can confidently speak of using such a vast number of people usage across the world.
Okay, now, what does science say about safety and why is medical guidance critical? Maybe we can take Dr. Chi-An and Ms. Wei take this question.
Sure. So, as a
Is this safe? Is this safe?
well, like any other medication, each medication comes with a side effect. But what's important is that, the patient should have that conversation with their physicians and talk about it because there's always a balance, risk-benefit balance. So, what's important also is that as somebody who works with Novo Nordisk is that we really put a lot of emphasis on patient safety. We take all of the safety reports very seriously. That's what I can see. And because of that, we have accumulated over 33 million patient years of data on semaglutide. Maybe I'll explain a little bit what patient years means. So patient years means the number of patients that have been on the medication times the number of years they've been on that medication. So it's the number of patients times the number of years, and you can imagine how big 33 million is. And with that, amount of data, we can say that, semaglutide for obesity has a relatively good safety profile.
All right, Ms. Wei.
I want to add just a little bit as well. And semaglutide and GLP-1 is actually the most studied molecule through the clinical trial and through rigorous studied clinical trial. And it's been studied in different populations, studied in, generally speaking, obese populations, but population with comorbidities together with obesity, such as diabetes, cardiovascular diseases, kidney diseases, and liver diseases. And semaglutide GLP-1 has also been studied with adolescents as well. So across huge population range with different characteristics, and therefore we can confidently say that with all this rigorous clinical trial data behind us, and with the real life usage by millions of patients using semaglutide every day, and with that safety profile, we can really confidently say that we will bring the medication not only not only help the patient to reduce weight, but also to protect the patient's heart, patient liver, and also kidney as well, and help the patient to live a fuller life and more accomplished life. And that's ultimately our goal.
You know, actually, I wanted to say that I've actually tried GLP-1s myself. And I personally, I saw the benefits, health-wise. I have friends and family members who have actually used GLP-1, and I've seen them get off maintenance medicine. And I personally experienced, honestly, lesser cravings. Even if I work out because I'm stressed, I would eat things sometimes. I realized that I wasn't hungry, but I would be eating. But when I got on GLP-1, for a period under the supervision of a doctor, I think that is the key. You really see a change in how you approach food and even how you move as a person and how you use your body, right, in terms of functioning.
Yeah, so maybe just to add a little bit, Ms. Karen, but I just want to share as well part of the immense amount of data that semaglutide for obesity has actually been proven in the studies to reduce food cravings by around 76%.
No wonder.
Yes.
Really?
Yes.
Oo, nagpapaya lang ako. But is that a fact? It's that much?
Yes.
Okay.
The data.
All right. So we're gonna open the floor right now to our friends from the media. I do hope you ask great questions, guys. Okay, the first one here in front muna tayo. Ma'am, okay, do you have a microphone? Can you give her a mic? And please give your media outfit as well.
Hi, good morning. I'm Larissa from Manila Society. First question is it available now in the Philippines?
Okay, quick question. Is it available?
Yes, it's available in the Philippines. So we're super proud that now we can have semaglutide 2.4 milligram, and which is called Wegovy, which is available in the Philippines now as we speak.
So that's the second question.
Who gave the big clap? Baka
But
story yan.
actually, she answered already my second question. What name should it be known here in the Philippines? So it's Wegovy.
Yes, it's semaglutide 2.4 milligram Wegovy.
All right.
Question and the last one.
Go.
Do you have a legitimate website listing that who can prescribe this drug? Or
I think that's a great question. Does it need prescription?
Yes.
You know that. Does it need prescription? Take this, Gian, quickly.
Yes, that's
Okay.
the short answer. Yes.
So yes. So if you want this semaglutide for obesity, you have to go to a doctor. The doctor will write you a prescription, and then you go to either Mercury Drugs, South Star. How many drugstores is this in?
Maybe.
Yes, and so we're working very hard with our retailer partners and to make sure that the new product is available in their branches as soon as possible. In fact, actually, we are starting to ship out to the branches as of today, and over the next few days or week, and it will be available across the country. So give us a little time, and maybe that you will go out in the nearest drugstore in Metro Manila, it will be available in the next couple of days, but in the provincial areas, it will be over the next week also.
And maybe just to add a little bit, our healthcare system has improved so much over the past few years. So you don't just have, now you can still go to your doctor, but again, there are telehealth partners that we can go to, no? And of course, but that's probably my most important question is that if you're interested, please speak to your doctors. They know best.
Always with a doctor. Always. Do not self-medicate and don't self-test. Next question. All right, thank you very much. Thank you. Another question. Yes, ma'am. Your microphone. Your name and of course media outfit.
Hi, I'm Molly Costa from TV Channel 23 and DWIC. I really love, I'm amazed at this wonderful creation. We should live lighter. I'm heavier this my height. And my age, I'm 69. I really have.
Wow, you're 69?
Mas matanda ako sa'yo.
No, you look great. You don't look 69. But go on. Yeah.
In any case, the question is the treatment options and strategy. We need to hear that right now so we can act on it. So what treatment recommendations do you have for everyone here?
Okay.
And, what happens if my weight loss treatment plan doesn't work?
Can you repeat the question, the first one? I think.
What treatment recommendations do you have for us? Because the ambassador, His Excellency,
What treatment recommendations? Okay, who wants to take that?
I'll take this one. So thank you, ma'am, for the question. But every person is different. Each one in this room is different. You all have a different health story, backstory. So it's also very hard for me to give a recommendation because that conversation should happen between you and your doctor. Yes. So, but I understand where you're coming from. I mean, right, when diet and exercise don't work anymore, right, it's very difficult. So I guess the next step is really to make that 6-year gap between your weight problem and visiting a doctor, make it shorter.
Okay, so there are a lot of questions and I want to ask them. Take this, let's all take this quickly. Anonymous, what makes Wegovy different from other weight management treatments currently available in the Philippines? Nakalagay anonymous pero Vivian Villanueva, Edge Davao. Thank you, Vivian. Alright, so what makes it different? Why don't you take this, Anna? What makes Wegovy different from other brands that are out there?
Yeah, as I said that in my previous comments, we can definitely speak about our product, semaglutide. As I said that it is time tested, which has been there in the market for quite some time and so many millions of patients use it. It has a proven, approved cardiovascular benefit. It has a clear documented evidence that it protects lean mass largely. It helps to lose fat loss a lot because that's what we are all looking for, and then it also reduces the craving. So these are the 3 to 4 distinct evidence-based benefit of our semaglutide which I can comment.
Alright, another question from Dr. Kilimanguru. How do we address the issue of muscle wasting while on GLP-1?
Yeah, so I'll take this one as Anand mentioned, no, that semaglutide actually has data saying that muscle mass is actually preserved. Actually, any weight loss can lead to a loss in muscle mass. There's always that ratio. But what's nice about semaglutide for obesity is that there is a preservation of muscle mass in the sense that 78% of the weight loss that a patient experiences is attributed to fat mass in the studies. So imagine if a patient uses 10 kilograms, 8 kilograms of that loss is roughly the fat mass.
So what you're saying is with this particular product, specifically this, is you will have muscle loss, but more of it is fat loss. But having said that, I think it's very important to understand that once you go on this treatment plan, right, it has to be holistic. You need to go to the gym and lift weights. You need to strength train. You need to eat right as well, right? Okay, any more questions from the media over here, ma'am? Go, this is very good. Actually, I can feel, honestly, the interest in the room because for so many months, I've had so many friends, people I know that are just really wanting more information about GLP-1. Okay, ma'am.
Hi, good morning. My name is Cathy Valmores of Life is Delightful. So I've been a blogger for 21 years. I actually attended your last event. And I told you guys, so I started before, I used to model. I was part of the pageant world, so I was very slim. So I was obese and I became extra small, anorexic, bulimic. And then I gained the weight again. I gave birth. So I've been through everything. My question is, so you said live lighter, right? So not to be the downer here, but this is something that a lot of people will take as a band-aid solution. They will try this out, they will lose the weight, but a lot of them will not have time because these are the same people who I don't have time, I don't have enough sleep, I don't like exercising, I like sweets, I like 3-in-1 drinks, I like my milk tea. So my question is, what is the side effect of taking this long term? Because again, if you're obese, it's not going to be easy peasy. 6 months, I'm slim. So it's going to be a long term thing. What will be the side effect of taking this long term? And then, what happens when something occurs in life and they suddenly have to stop taking this? It could be financial. They can't, handle the cost of taking this again just to maintain things. What happens when they stop taking this? Will they just bounce back? Can you tell us more about that?
Well, that's a great question. And your story, we could have had you really on stage with your story. I'm not kidding. You are like, wow, the story for this GLP-1. Okay, let's start with that.
Yeah.
Long-term use. I'll be honest. People that are on GLP-1s for obesity, they stay on it, frankly. You can stay on it for 3 years. I know some people that are on it for a year already. So, ang tanong, what's the long-term side effect?
Thank you for your story. I can relate, but not the beauty queen part, only the weight part. Yeah, so side effects. Semaglutide is a GLP-1 receptor agonist, and like all other GLP-1s, the most common side effect is the gastrointestinal. So nausea, vomiting. That's the most common. But thankfully, these are transient, ibig sabihin saglit lang, and they're mild to moderate in severity. But that's also why you have to talk to your physician. Close follow-up po talaga. And then I think the second question of, the longest actually, this molecule has been in the market for around 10 years, right? So that's the longest that somebody has been taking it. The second question is rebound. Maybe that's what you're more interested
Parang,
in.
do you gain back the weight? Some have said the minute you stop, you gain back the weight 3-4 times.
Yeah.
Is that true?
Well, it's different from person to person. But there is that phenomenon called the rebound phenomenon. And I think that highlights also why this medication is meant for obesity, which is a chronic disease. Because like hypertension, if you stop your medication, your BP goes up. Diabetes, if you stop your medication, your blood sugars go up. So just like that, it sort of puts us also in the mindset that obesity is something that we should be dealing with seriously.
But it also means that we should change our habits. Yun din yun because this isn't okay, close your eyes and then it's a miracle drug and that's it. It's aiding you. It's helping you. But you also have to do something. You need better choices. You wanted to add, Alan?
No, I can just add on that. One thing is for sure, like Prashant was talking. Semaglutide is one of the longest used GLP-1 as on today, which we can confidently say, for a long-term usage point of view, because this is the first GLP-1 to come in the market. Number two, about the weight gain once we stop the treatment, we know this is a chronic disease which require a sustainable long-term treatment. But we are also seeing a lot of early data coming in, but we need to wait and watch. It also gives us some good news in terms of those people who are able to preserve the lean mass. The gain effect is not so high, but as of now, it's all very early data. It is not approved legally or regulatory point of view, just a disclaimer. But these are all the molecules less than 10-15 years. We need to wait for long to see that impact.
Okay, quickly, can you take this? Quick questions because we have 5 minutes to go, but this is from the audience. Quick, what is the difference between Wegovy and Ozempic? That's a good one, especially their journalists in the room. Take this way.
Okay, so Ozempic has been a big market for the last 5 years. Ozempic is indicated for diabetes treatment, and Wegovy, which is going to be available now, is indicated for obesity treatment. And for Wegovy, it represents a higher dose. And we also know, actually, one of the characteristics of GLP-1, the higher dose you go, and the more weight loss you will get. So it's really dose dependent. So that's really the difference. both Ozempic and Wegovy are coming from the same molecule, which is semaglutide.
Okay, so the difference is, other than the indicated use, is the dose of Wegovy is different. It is higher, which is really for weight loss. Okay, quickly, what ages can safely take Wegovy? The age.
Wegovy, semaglutide Wegovy is approved here in the Philippines from the age of 12 and up.
Okay, 12 years old. Best to bring your child to a doctor, and the doctor will determine if the child is obese and watch, okay, the results of that. Siguro ito, okay, tinanong na where is it available. Okay, can you still take semaglutide Wegovy and do cardio exercise?
Definitely.
Definitely.
Yes.
All right.
Exercise is so important.
Okay,
That is
dapat.
important, I would say, because medication alone is never going to solve all the problem. And we need the diet and we need the exercise as well. So it's important to actually have the lifestyle change together with the medications.
Okay, anybody else? Before we close, one last question. Okay, well, first of all, I want to thank our panelists for joining us this morning. And I think this is just the beginning on what Filipinos need to live lighter. You know, information will keep developing, improving, science keeps innovating, and I think this is a step forward to living lighter. Thank you to all our panelists, Dr. Chian Montefalcon, Ms. Weisun, Mr. Anand Shetty. Please give them a hand. Thank you.
Ganyan ka pala.